So basically we have the wave. This is the wave when the electrical conduction of heart is started, and heart started its function, and here one complete beat is completed. Okay, so from starting to ending of one beat, the electricity or the electric conduction is started at SA node. Okay, first step is it is started in SA node. So starting or beginning is graphically presented here. Okay, and the after beginning it is ending. Okay, it is ending. So SA node started its electricity, and then we have atria. Okay, we have atria. Both right and left atrium are contracted. Then what will happen? The electrical conduction of from SA node it will go to AV node, from AV node to other area of the heart. So it is the completion of contraction of atrial. Next we have ventricle. Ventricle is begins. Beginning of ventricle is graphically represented here, and it is contraction and relaxation. This is the beginning of the contraction. This is the peak of the contraction. This is the ending of the contraction. Okay, so this is atrium. This is ventricle beginning of the contraction, beginning of the peak of the contraction, and this is the all the wave is contraction. Here we have a near relaxation. We will get this way. Okay, some relaxation. After relaxation also we have some electric conduction. So there's the reason we will get this waves. Okay, so basically this is the complete wave of each beat. So this is graphically represented in the in this electrocardiograph. Okay, so you can see that this is the waves. So basically you have P wave, Q wave, R wave, S wave, and T wave. Okay, so we have from P to Q we have one interval, one segment. P to Q. Sorry, one interval is there. One interval is there here, and R to R one. Sorry, Q to T one interval, because it is one complete cycle. Okay, here P is a one cycle, Q R S T is a one cycle. So we are taking Q to T as a one interval. P to Q is one interval, Q to T one interval, and R to R one interval. From R to another R, we have another we will take another interval. And here are segments. P to R one segment. Okay, because P is also a peak level, R is also peak level. Okay, P to R, and next you have no other segments here. S to T, because S is also the peak, in the peak. This is the S wave. Okay, this is also T wave. Here we have the T wave. So we are taking S T wave segment. So P to R one segment, S to T one segment, Q to T one segment, and we have QRS complex. We will combine QRS and we will call QRS complex. Okay, so these are the things we have to remember. These are the two things are very important. When is the P wave is forming, when Q wave is forming, R wave is forming, S wave is forming, T wave is forming. So uh, T wave is forming. So basically, so this is also uh, in diagrammatically we will understand here. Hmm. Okay. Next, What are the waves are? I told you P wave due to the atrial beginning of and ending of contraction, QRX ventricle contraction, and T wave is at the ending of relaxation. Okay, so basically, hmm, so here one next important thing is that is ECG paper. So they basically it is look like this the paper ECG paper. I will also we will also see in the we will see in ECG. Hmm, hmm. This is the complete ECG paper. So this is the ECG paper. We will see. What is Excuse me, 1 second. So this is the ECG paper. So you will able to see this paper. Okay, when you will receive an ECG. Okay, after done doing a ECG, will get this paper. So you have to see what we have to see. This is the biggest question. So basically, you are seeing one, two, three, four. Sorry, one, two, three leads. Here, four, five, six leads. We have to able to see here. AVR, AVL, AVF. Next we have V1, V2, V3, V4, V5, V6. Okay. So this is an ECG. Okay. So this is the ECG paper. First we will read the boxes. Okay. So what are the distance between the boxes and how much distance we have to remember. So basically this is the one line and this is the one line we have. See the uh, one line horizontal and one vertical is there. You are able to see this is the one box. Okay, so we have here horizontal, this is vertical, vertical, horizontal, vertical, horizontal. This is a square box. Square means all four areas are equal. So here in ventricle axis the this space is 1 mm. How much? This is, sorry, ventricle axis, two large squares. So this is one box. Okay. So the diameter of each box is 1 mm. Okay. The complete box is 5 mm. Okay. This is one box. So this is in one box is 5 mm. So we have each one box 5. Like this, we have 5 boxes. Okay. One, two, three, four, five. 1, 2, 3, 4, 5. So to have 25 boxes means if we calculate, we have 25 mm. Each box is 1 mm. So all boxes 25 mm. So if you multiply 25 into 1 2 3 4 5. 1 2 3 4. This is 1 5 2 3 4 5. 5 into 5 25. Okay, 25. 25 boxes are there. Okay, so if you remember that 1 mm, to travel 1 mm, the electricity required, it is 0.1 microvolt. Okay, so one large box, it will take 5 mm. Okay, one box is 5 mm, no? So 5 mm, 0.5 microvolt. For two boxes, how much? 1 millivolt. Here microvolt, this is millivolt. For two large axes, we have to need 1 millivolt current. If you come to horizontal axis, the amount, the amount to travel, the amount to travel horizontally, this is horizontal. Okay, it will take 0.4 seconds for one small square. So for this square, for small squares, this is 1 mm each breadth and length. So for one small square, it will take 0.4 seconds. How much time? 0.4 seconds. Okay, for large square, this is small square. For large square, it will take 0.2 seconds to multiply 0.45 into how much boxes are there? 25. So what we will get? 0.2 seconds. Okay, 200 milliseconds. 5 large squares, it will take 1 second. So basically, so to travel each box, we will need 1 second. How much time we have to require? 1 second. So you have to remember these two things. So this is one box 1 mm. Okay, large box is 5 mm. Okay, and uh, how much time? 0.2 second for one box. For whole 5 boxes, 1 second. So this is the thing you have to remember. So again, we will see. You can see this is the 5 mm box. Okay, so 5 mm box take 0.2 seconds. So you take 1 mm, 0.4 seconds. Okay, 0.4 seconds. So for whole box, we will need 1 second. In this box is the tiny box. In the tiny box, one box. So one box is 1 mm. 5 boxes, 5 mm. Whole box will take 1 second for 25 mm. Okay. So how much duration will ECG take? So this is box wise we are understanding. But here ECG, according to ECG, an interval PR interval, QRS duration, QT interval, ST interval. So it will average 0.18 seconds to 0.12 or 20 seconds. 0.8 seconds, 0.4, 0.32. So this is the normal average times the each wave takes. Okay. Now we will discuss about ECG leads here because it is very important. According to this paper, okay, which I explained you here, you are able to see that this 1 2 3 4 5 6. Okay, V1, V2, V3, V4, V5, V6. What is that? This is very important. Now we will discuss those things. So basically, whatever leads means the current by which the machine will accept. Basically, it is the North Pole, South Pole, and the conduction of heart. Okay, the conduction, electrical conduction of heart. Okay, through those wires, we were able to collect the information, and the machine will accept, and then the missile will give graphically presented the heartbeat and electrical conduction of heart. Now we'll see the leads. We will now we'll see in this diagram. Okay. So here we have this is the leads. Okay, I think you saw in the uh, any hospital, any of your hospital, whenever your any person, your family member admitted in the hospital. So first of all, they will do ECG. Okay. I think the complete picture is not given here. So this is best picture, I think so. So this is the V1, V2, V3, V4, V5, V6. Okay. So this is the one thing. I think you understood that the electrical conduction of the heart is calculated from this all this area. Okay. Nearby area of the heart. Hmm, I am not getting that picture. Okay. This is the only picture here I have. So you think one lead here, one lead here, and one lead here. So here V1, V2, V3, V4, V5, V6. Okay. So what is that? ECG leads very important. Leads are electrodes. I told you electrodes, electrical conduction, which collects electrical conduction, which measures the difference in electrical potential between either. Okay. First, it will collect the mm, collection of electricity with the help of electrodes. These are the leads. Okay. First thing. Second thing is that the the difference between here we have the heart. When heart beat started, we will get exact uh, beat and exact electric conduction of the heart. Okay, from that area to the upper leads, from that area to lower leads, how much amount of electricity we have to collect. So from that point of view, we will able to understand the electrical conduction of heart is either normal or not abnormal according to the graphical presentation. Okay, first what will happen? We have two exploring electrodes attached to the surface of the body. Okay, one point of one point on the body and visual reference point electrodes with zero electrical potential, unipolar leads. So basically, you have limb leads. Limbs means hands. Okay. Bipolar. There are bipolar both sides. Okay. Limb one, limb two, limb three, and we have unipolar single leads. Only you have to attach on the chest area. That is V1 to V6 and A VR, AVL, and AVF. So basically, we have ECG are mostly 12 leads. 12 leads ECG are most common. Okay, but different cardiologists have different opinion upon that. So according to the condition, the cardiologist will advise what type of ECG you have to do. But most common and uh, in every in every hospital or in every diagnostic centers we have this 12 lead ECG. So in that we have three standard limb leads, okay, and three augmented limb leads and six unipolar precordial chest leads. So you can see that this is the if you think this is ECG machine or conduction. So this is the one lead here, one lead here, one lead here, and another leads is here. Okay, V1, V2, V3, V4, V5, V6. This is the one way. So connection of the body with the electrocardiogram, the recording chest leads. So basically here you are understanding this. This is what does mean LA. RA means right arm. LA means left arm. Okay. This is another conventional arrangement of electrodes for according to the standard electrocardiograph leads. Enthoven's triangle is superposed on the chest. So basically this is the old theory. With this help, they able to conduct the electrical cardiogram of heart. So basically, this is the in the right leg we have negative charges. Leg from negative, this is negative charges. So this has in left arm we have positive charges. In left leg we have to we have put positive charges. So basically this is the lead one, negative to positive. Okay. In the lead two we have negative to positive. In the lead three we have negative to positive. So all the direction is negative to positive, negative to positive, and negative to positive. So basically, I for some understanding only I'm explaining, but practically we are not doing that. Okay, this is the Beethoven's way. Okay, so here where we have to connect it lead one, lead two, lead three, AVL, AVF, V1, V2, V3, V4, V5, V6. So here the area is given. Okay, so where we will get what type of graphs. Okay, if v1 here, v1 is there because SA node, nearby SA node is there, so you will get this type of, okay, this type of graph. In v2 we will get this, v3 this type of, v4, v5, v6, and leads, AVR leads like that, AVL lead, and lead 2, lead 3, and APF. So basically, this is a singular representation of the graph. Okay, each like that we will get. Where do we have the image? No. So this image. Okay, this is the main is. This is the every single different areas. Lead one, lead two, lead three. Okay, and we have V1, V2, V3. Okay, V1, V2, V3. So it is the area where we have to see the graphs. Okay. Next, I think some misconception is there, I think, in your mind, but it will take some time to understand ECG. It is not easy like that. So basically, in lead one, you're able to see this type of graphs. In lead two and lead three, so these are the graphs, so which you're able to see in three standard electrocardiographic leads. Okay, AVR, we'll able to see AVR like that, AVL and AVF. This is P, Q, R, S, T, U, P, Q, sorry, P, Q, R, S, T, P, Q, R, S, T. So basically, AVL, you will give the exact graph which you're able to see. This is the leads. So this is V1, okay, V2, V3, V4, V5, V6. Okay. From here we will discuss tomorrow because uh, basically not much. We have only one thing. So you have understood. So, okay. U wave. So U wave is not seen in the uh, graph because it is a typical small. Okay, follows the T wave. We will able to see here. Here T. This is the U. Hmm, something like that. Some. something like that. Represent, how, what is the represent of U wave? It is the papillary muscle or Purkinje fibers. So basically, when you when you wet the floor, what you will see when you wet the floor, at the beginning there is some water, at the ending there is no water, but there is a dry wetness on the floor. It is also due to the water only, but sometimes it will take time to dry, okay, because there is a moist area. So like that only, at the ending of the relaxation, you have some sort of current waves which will able to see. So that also graphically represented. So the ending, post ending area, the key Purkinje fibers, that is U. But in some cases, you will able to see U wave. So what are the condition in hypokalemia, when the uh, potassium is decreased, potassium and calcium is increased, thyroid toxicity is seen, okay, and anti-erythemax, okay, and you will see congenital diseases, QT syndrome, congenital heart diseases. You will able to see U wave, okay, and also in some cases like ischemic heart diseases, it means uh, diseases of arteries in the heart. Okay, if the in the left ventricle, if the if the blood is in large amount also, you will able to see U wave. So basically, in some cases only we will be able to see the U wave particularly. So I think you understood. We completed basic part of the ECG. So what are the ECG? What are the leads are used, and how much amount of the boxes are there? Okay, how the ECG? What is ECG? This complete or and basic information we discussed. So I think you understood. If you not understood, you have to watch the video once again, and you have note down, and you have to remember. This is not something that this is you will get by uh, practical or something, but you have to remember that this is the thing you have to remember, and you will apply practically. Then only you will have understood. Okay. So if any doubts, you can ask me.